Okay, we are live. We have a few people popping on. Just so that we can make sure that the audio is working, I'm just going to have you guys, if you can hear me, please type which state you're tuning in from in the chat box, please. And then we will get started as soon as I see that people can hear us. All right, cool. We have California, Washington State. Okay, we have California, Ohio. Awesome. Okay, so let's just jump right in. And I'm sure more people are going to jump on as we, as the minutes pass by, but let's just get started. For those of you who don't know me, my name is Brittany Roman Green. I'm also known as @BrittanyB_TheRD on Instagram, and I'm a registered dietitian nutritionist specializing in helping people with Crohn's, colitis, and IBS get into symptom remission, boost their energy, and gain a better relationship with food. I'm so excited to have Dr. Travis as my guest today, and we're going to jump into the interview in a few minutes. But first, I would love to introduce her so that you guys know a little bit more about her background. So Dr. Travis is a psychologist in private practice in Oakland, California. She specializes in treating individuals and couples managing chronic illness, pain, trauma, and anxiety. Dr. Travis received her doctoral training at the California Institute of Integral Studies and completed her residency at the Pain and Functional Restoration Clinic at Highland Hospital and the Acute Rehabilitation Department at Fairmont Hospital. Dr. Travis is a member of the Crohn's and Colitis Foundation of America, Northern California's chapter Medical Advisory Committee. And on a personal note, her mother was diagnosed with Crohn's disease when she was 10 years old. So I'm going to be asking Dr. Travis questions requested by my Instagram audience. And then we're going to be accepting your questions at the end. So please use the chat box throughout to ask questions. And then I will kind of go through them at the end and I'll ask them to Dr. Travis. Also, I wanted to make sure that you guys all feel comfortable. So all of your comments are going to be private and they're just messages to Dr. Travis and I because, I just want to make sure everyone feels comfortable asking questions. And before I get to the interview, I actually wanted to share a personal story about my own experience in working with a mental health professional. Because I think there can still be a stigma around mental health. And I know personally that the time that I went to a mental health professional, it made a huge impact on how I felt overall about my condition. So some of you may know that in addition to ulcerative colitis, I also have a condition called primary sclerosing cholangitis, or PSC for short. And it's a rare progressive autoimmune bile duct condition that damages the tubes that connect the bile ducts and the liver. And it can also lead to liver damage and eventually may require a liver transplant. It also significantly increases the risk for getting bile duct and colon cancer. So when I was first diagnosed with PSC, I was devastated because as soon as you get diagnosed, you go to Google and, all I kept seeing was basically in 10 years, I would need a liver transplant and all of, my risk for dying and all these really scary things. And so I really struggled with coping with my diagnosis for about 6 months. Anytime I was alone, I would start crying uncontrollably and I would have an anxiety attack. And finally, I mustered up the courage to ask my doctor for a referral. And I finally met with a psychologist. Honestly, just one session made me feel tremendously better. It felt like 100 pounds were lifted off my shoulders. And I felt like I was finally armed with the tools that I needed to deal with that diagnosis. And of course, I'm not saying that everyone's going to feel better after one session, because frankly, I may need to go back at some point. But I guess the reason why I wanted to share this personal story with you guys is because I'm really hoping that it's going to inspire you to contact a mental health professional if you think that you might benefit from working with one. Now, I initially met Dr. Travis a few months ago in person. I guess I met her in person a few months ago when we were both sitting on the medical panel for the Bay Area Crohn's and Colitis Foundation patient conference. And I was very impressed with how she answered all the patient questions. But there was one particular response that really hit home for me. And to be completely honest, I almost started crying. I had tears in my eyes from her response. And I think, that's also what made me really want to reach out to her and have her speak to you guys today. So I'd actually love to start off with that question the patient asked. So, and have you answer that first. So, Dr. Travis, does stress trigger flares?
Yeah, so when I got this question at the panel, I wasn't surprised. It's a common question that gets asked quite a lot. And what I said was, often when people ask that question, they're really asking another question underneath, which is it my fault that I'm having symptoms? Am I doing something that's making my disease worse? And what I said to this person was, it's not a helpful question. It's to ask the question if you're responsible. Generally what that does is it just causes someone to go into a shame spiral. And it's really hard to think clearly and think in ways that are helpful to you if you're in a shame spiral. So even if it's possible that there are things that you could do differently to handle your symptoms, if you're in a shame spiral, they're not going to come to you. Helpful thinking, create more creative solutions come from a place of softness and kindness to yourself. And so it's true that stress can influence disease progression or symptoms or interact with symptoms, but to look at your role in it from a place of self-blame is just not helpful.
Yeah, thank you so much for sharing your response to that. I know a lot of people need to hear that, and I thank you for answering it. Yes. So, okay, so I'm going to ask a few other questions. So, how can one learn to accept their diagnosis and not to be learn how to not be anxious about their future health?
Yes, that's an excellent question. And the truth of the matter is that a certain amount of anxiety and concern for your health is normal. So the real helpful part of that question is what's appropriate. So it's important to look at how you can be in the reality of what's actually happening. And what a lot of us do is we go into fortune telling, which is a cognitive distortion where we decide what we think might happen, or we catastrophize. And I want to say these are all normal ways for our mind to go. I mean, they're literally like wired in to us. So there's nothing wrong with catastrophizing. There's nothing wrong with fortune telling. We all do it. But it's important to catch yourself and say, okay, I'm doing this really normal thing that my brain wants to do to protect me. It wants me to prepare for all the terrible things that can happen. But let me just kind of come back to reality and look at what's actually happening today. And that doesn't mean you can't prepare for the future, especially when you're first diagnosed. It's really hard to know what the next year or the next 5 years is going to look like. So also know that you'll know more about your illness and what it's going to mean to your life in the coming days, months, years. But there's some things you just can't know ahead of time. So that's what I would say.
That's great. Yeah. I know that was something that I really struggled with, my PSC diagnosis personally. And I know there's a lot of people out there struggling with their IBD diagnosis. And so I think, that's really helpful. I know for me, like focusing on the present and trying to, stop those not helpful thoughts definitely made a big impact and helped me.
Yeah.
For sure.
I mean, I encourage people, especially in the beginning of their diagnosis, to reach out to their doctor frequently. If you don't know if something's an emergency, that's okay. That's what your doctor is there for. But in time, you'll know what symptoms are more concerning or less concerning. But there's no way to know ahead of time. It's something you just live and learn as you have the illness.
That's very true. Yeah. So another person asked, do you have any advice for parents of IBD patients around helping them to feel less hopeless? It's a situation that I personally never dealt with, but I'm sure my mother could have, appreciated this, or my parents. And I know that there's a lot of, there might be people here tonight who are parents of IBD patients who, just want to do everything they possibly can for their children, but it's a hard situation. So do you have any advice for that?
Sure. So again, hopelessness is one of the songs on the playlist that comes up when you're a human being. And it's important to just realize it's a normal thing to have arise. Often what's underneath hopelessness is fear. And so it's important, if you're feeling hopeless, to really get in touch with the fear that's coming up. And again, to realize it's normal to have fear, and look at ways that you can soothe yourself, or get soothing from someone else, or even from watching a fun, distracting TV show, right? And also to notice you might be feeling hopeless in one moment, and then chances are you're not going to have that feeling later on that day. And so if you can remember that, and it's hard in the moment because the feeling is so big, right? But if we can remember that things change, from hour to hour, and to just try to, and so if that's something that somebody tends to fall into, like if that's a ditch or a song that keeps playing on their playlist repeatedly, I say make a little note, have a little cheat sheet, a little 3x5 card that you have as your go-to when you get into panic state, that says, okay, I know the hopeless feeling is going to come up again. And I also know the last 5,000 times it happened, it was gone by dinner time.
That's great. I love the, little card to yourself. So I guess, because I know that there's probably a lot of people out there who want to work with a mental health professional, but they don't even know where to start. How do they find someone that will, to jive with? How do they find someone who, is right for them? So do you have any, I guess, tips for that?
Yes, absolutely. So the relationship that you have with your therapist is almost the most important part. I mean, you want someone skilled and trained, but if the relationship is not there, you can have the smartest, most well-informed, educated therapist in the world, and it's not going to help you because you're not going to be open and trustful, right? And so I think it's important to feel a sense of trust. And it doesn't mean you have to feel complete trust, but just a sense that this person gives you a sense of safety, a sense of being welcomed, that all of you is welcome. That's a nice feeling to have during therapy. And, a sense when you leave, when you just felt like, oh, I could just really be myself. And I felt encouraged to talk about what was really going on with me. That's a really good sign when you realize, oh, I opened up and I maybe said some things I didn't think I was even going to say. Those are all good signs that you're connecting with someone that you're going to do good work with. And I always say there's so many therapists out there. If you're sitting with someone and you try a few times and you're not looking forward to going back, that's a red flag that it's not a good match. It's much better to just move on and find somebody who is a good match for you, because when you find that person, it just can make things so much easier.
So do you feel like there are, is there a way ahead of time before you even meet them, like questions that you could ask to see like maybe this person would be a good fit? And do you know what those, or can you share with us what those questions would be?
Yeah, I mean, a really good question is to just say, how do you work with people who are dealing with my kind of issues? If you've had a therapist before that didn't feel so good, you could say, I worked with this one person who worked with me like this, and that didn't feel so good to me, and wondering if you work differently. So I think those are good questions to start with. And then it's perfectly fine to ask them any questions you want to ask them. If they've worked with people with your issue before, what tends to predict success, that sort of thing.
Oh.
Also, I give homework, and I say that in a playful way, because if people don't do it, that means that wasn't the right homework to give. And then we realign and reassess and figure out something else that would be helpful. But I like people to try things in between appointments. And some patients don't want to work like that. They don't want to do anything between appointments, and that's fine. And there are many therapists who are happy to work with people who don't want to try anything differently in between appointments. But that's the way I found that people tend to benefit from the work that we do together. And so I have that as something I'm interested in, find somebody who's excited to work in that way.
Yeah, no, that's great. And thank you for all those questions. I think those are good questions to ask to figure out whether you're a good fit with someone. So Thank you.
Yes.
So
also, before we move on from that question, if somebody feels that, even though you might be coming to a therapist to work on symptoms, on help with symptom support, if you feel like you want to meet with somebody who's a match for you in terms of your cultural background, racial background, sexual orientation, gender, those are also things that are totally okay to want to need and inquire about if you don't know about the person's background.
That's a really good point too.
Mm-hmm.
Yeah, thank you. So, okay, and then another person asked, how can one cope with the anxiety around, this is a tough one. So how can one cope with the anxiety around urgency or having accidents that affect, all areas of life, like travel, work, interviews, test taking, social activities?
Absolutely. So, okay. So number one is acceptance. We have a body, we don't really control that body. And the truth is that we all have bodies that sometimes are feeling differently than we would like, smelling differently than we would like, making noises that we wish they were not making. Even folks who don't have IBD have to cope with that issue. Okay. The other issue is preparation. This helps people more than anything. So having your little emergency bag that you carry with you all the time, and even if it's just a change of underwear and some wipes, something, you know, carry a backpack, get it, you know, if you want to have a nice purse, get one that's also a little bit like a knapsack, like a pretty leather knapsack that you can carry things with you at all times. And even if you never need them, and often that is the case, just knowing you have them is going to reduce your anxiety, and it's going to create less of a chance for it to happen because you're less anxious. And I've had people wear adult protective guards to situations where they just said, like traveling on a plane, for instance, a long distance plane ride, and just to be safe. And it lowered his anxiety so much that he didn't have an accident. In fact, I've never had someone actually have an accident when they've gone to that length to make themselves feel prepared. So in terms, and often another thing that comes up, like test taking, people are afraid to ask for accommodations. You can get a letter of accommodation from your therapist or your medical doctor that doesn't say specifically what's wrong. You know, what the concern is. It could just say this, it will just say this person, and it shouldn't say specifically what the medical issue is, because that's a breach of confidentiality. So a letter of accommodation is simply going to say, this patient, it's my professional opinion that this patient needs these accommodations to help with her medical issue. And it won't be vague like that, the medical issue. And so, you know, it is your right to get that support and to set yourself up for as much success as possible. To address the worst case scenario, often I work with people on the feared fantasy. So we talk about what is the worst thing that could possibly happen at the job interview. And we just go through it. Okay, like, oh, okay, some noise comes out of your body and no one's expecting, and we just go there. And so because we go there, the person doesn't hold on to the fantasy. And we talk about how they might breathe through it. Chances are, you know, usually what happens is when the unmentionable happens, people don't mention it. You know, there are lots of things we've all encountered where we've just said, okay, I know that just happened and I'm just moving on. So, and people often have these fears, and to be honest, nobody in my practice has ever told me a story where the thing they were afraid of actually happened. You know, it could happen someday, but not so far.
Yeah, I think you mentioned a lot of really good points. The fact that, you know, so to be prepared and to have that emergency kit, just so that you feel a little bit more prepared, so that you're not as anxious about what if it happens, kind of preparing for those worst case scenarios, and then also breathing through it. If you start noticing you're starting to get anxious and you have some symptoms that, you know, some pain or you know, something arising. I've also had clients that, you know, they practice, you know, breathing through that moment. Oftentimes it does actually go away because it ends up being more of a anxiety around triggering the symptoms that ends up triggering the symptom instead of just it, you know, the symptom happening.
Right. Also, I do role plays a lot. And I have a background in theater, so I love doing role plays. So I'll play both the patient and the interviewer, you know, and then we'll switch roles and we'll just keep doing it until it feels less scary.
Oh, that's great. That sounds very helpful. I'm sure a lot of people would benefit from that.
Yeah.
Okay. So how, this is a tough one too. So how do you work through PTSD around physically painful flare-ups?
Yeah, so PTSD is related to safety. And so what we would do is we would look at how that person creates safety in their life in general. It's impossible to be safe at all times. We all know that. Those of us who live in California, no, there is going to be an earthquake again. All right. So we deal with a certain amount of uncertainty and a certain low level of fear often, right? But what's important is if somebody's had a bad experience, that they get used to creating safety for themselves again, right? Like a lot of us have traumatic experiences, but we don't get PTSD from them. So PTSD is where you get stuck in the trauma response and you get stuck in feeling like it's happening again in real time, or it's going to happen again. You have intrusive thoughts and memories that it is going to happen any minute. And so I work very actively with people when they come into my office, or even if they see me online, and I can see people anywhere in California online. Just talk about, how do you know you're safe now? What does safe feel like? Is there anything you can do to make yourself feel even more safe? Like, would drawing the blinds in your room help you feel more safe? Would going under the covers give you a feeling of safety that you can bring to yourself? And so I help people resource themselves, both internally, in terms of how they know they're safe, and also externally, what can they change in their environment to feel safer.
Okay, great. So I guess what might be a good indication that someone might really benefit from seeing a mental health professional? Like, are there signs or symptoms or?
Yes, absolutely. So if you feel like your sense of functionality is declining, like we all have bad days from time to time. We might even have a bad week. But if we notice that our functionality is really declining, meaning we're doing less work at work, not just for a day or a week, but it's ongoing. People in our community or families are saying, hey, you just haven't been yourself for a while now. Like, you're not moving through it. That's also a sign. So decline in functionality, other people noticing that you're not yourself, that you used to be somebody who is more present, more able to connect, and somehow they're missing you, that you've gone somewhere else. Those are signs that it's important to get support. Also, any thoughts about hurting yourself, hopelessness. So if people are starting to feel hopeless, starting to have thoughts that things aren't going to get better, thoughts that they don't want to be around anymore, those are all really important red flags to go get help. And the other thing is, sometimes it's fine to just get help for wellness support. You don't have to be at your worst. You don't have to be in a situation where you're not functioning anymore. It can just be like you just think you could feel better, and you'd like a consultant to kind of help you look at things that you could do to make things better.
Oh, thank you. Those are really great points. Thank you. So when in a flare and dealing with pain, what techniques can be used to distract yourself from the pain?
Mm-hmm. Okay, so pain is an important messenger. So we don't want pain to go away completely. And sometimes it's so bad you can't distract yourself. That is just the truth sometimes. Sometimes there's no way to get away from it. We just have to wait it through. So there's two ways to wait it through, and one is easier than the other. If we're waiting it through, saying things to ourselves like, this is never going to end, I'm going to die, I can't stand this, that makes it harder. If we wait it through saying, I've had this before, it passed, I'm breathing, trying to soften, even just 5%. It's a natural thing to clench up when you feel pain and discomfort. So that is going to be your go-to. And that's fine. But as soon as you're feeling that clenching, to just say, okay, can I soften just 5%? And that can help the pain, A, be less intense, and B, move through faster. No guarantee. Neither one of those things is 100% reliable, but it often will help. And yeah.
No, that's really helpful. I mean, I think that's probably why they have pregnant women focus on their breath while they're breathing, right? Or women in labor, I should say.
Yes, yes.
So.
Also, you just helped me remember another thing you can do, and that is focus on another part of your body that's doing okay. So you might have some intestines that are having a terrible day, but you can say, oh my God, my hands are fine. I'm so happy my hands are fine, or my hearing is great today. Or all my toes just work perfectly. And that can help. Because the brain can only be focused one place at a time. Sometimes the pain will be so acute you can't focus for very long anywhere else. But even if you can just get a couple seconds somewhere else, that means the brain is not focused on the pain. Also, another point that's important is it's better not to say the pain, to not say the P word when it's really bad, because we have a lot of associations with pain, like just the word. Like I can say a certain kind of ice cream and you'll automatically get a pleasant sensation. And then I can say the P word and that brings up stuff too. And so when you were caught up in a P flare, you want to say discomfort or sensation. Like sensation is neutral, right? I would actually recommend that over discomfort. So I'm having sensation now. It'll pass. Probably it has so far. And that's another thing. It's really important to not be too positive. Because if you tell yourself, I'm okay, and your body is telling you you're in an emergency, you can tell yourself you're okay all day long. It's not going to help. You have to tell yourself something your brain can believe. So it can be mildly positive, but it needs to be something believable, like, oh, I've been here before and it's passed.
Yeah, I really like that. So focusing on, prior success of getting into remission or having the pain pass, or sensation pass. Using the word sensation instead of the P word.
Yep.
And then I also really like the point about focusing on, having, focusing on another part of the body that feels fine. I like that a lot. So those are really good tips.
But I just want to say these are suggestions and they're not going to work for everybody. Like I know one person and the focus on another part of the body was a game changer, but I can tell you 10 other people it did nothing for them. So a lot of the work I do with people is trying different techniques and failing fast. Like if one doesn't work, we move on to the next one.
Yeah, everything has to be individualized.
Yes.
So.
Yes.
Okay, and this is another good question. So how do you feel confident and attractive in your own body when you have IBD?
Okay, so it's important to remember that people without IBD also have a song on their playlist that tells them that they're not attractive enough, not sexy enough, whatever, not enough, right? It's a really normal song to have on the playlist, okay? And so it's important to recognize that it's going to come up. Like our culture is really not conducive to being friendly towards a colostomy bag or towards even a bloated stomach, right? And so it's important to realize we're up against a lot of cultural messages that are really good at telling us we need to buy things to help with discomfort, emotional or physical discomfort. And so when we have those feelings come up, it's important to realize the bigness of what you're up against. Like it's not just a quiet song on the playlist. It's a really loud, blasting, like pop ballad, like stadium pop ballad version of the song on the playlist. They're really, really distracting to our sense of well-being. So once you kind of are kind to yourself in that way, it's important to focus on the parts of your body that you do feel fine about. And remember that, maybe it's been a minute since you felt attractive. But that doesn't mean it's not going to happen again. And also talking to somebody else about it, talking to a friend and realizing it's not abnormal to feel that way. And from time to time, we all do.
Yeah, I think that's a really good point. It's not just people with IBD who have these worries about this. And I know dating can be a really tough thing for people with IBD. I know personally growing up, it was hard for me to date when I was symptomatic, because of, just not feeling great about, my body and also how I felt, in terms of confidence. So I think that's a big thing that a lot of people struggle with.
Yes.
But also, what teenager doesn't think that?
Exactly. Exactly.
So that's a good point that you make.
I heard a story from someone who said, I tell everybody on the first date, this is what I have. And if they're going to have a problem with it, I want them to just walk away then and have neither one of us waste any more of our time. She was very confident that when she found somebody who was the right person for her, they would just say, okay, yeah, what else? What's next? And just take it in stride. And that actually did happen.
That's great. Yeah. I think that's a very hard thing to build up confidence, or at least it would for me to build up confidence to do that. But I think I can't imagine on the other end how the relief you must feel after finally getting the courage to do that, and then to get accepted anyways.
Exactly. And I tell that story just so there was somebody who did it that way, and had a happy ending. And that doesn't mean that's the right way for everyone to handle it. But this is also something that role playing can help a lot with, to just have the practice of having the words come out of your mouth. I have this thing I need to tell you about. Here's what I have. And then have somebody role play asking questions about it. And because then it just becomes less scary, because the words already came out of your mouth. You already practiced. But that's the kind of thing a therapist or a good friend can definitely help with.
Yeah, that's great. Thank you so much. So, okay, so I want to ask one other quick question, and then we'll jump to the questions that people who are here, we'll get to those in a minute. But what is the most important piece of advice you could give someone with a chronic illness?
Be kind to yourself. And I think that's the most important advice I could give to anybody. It's the thing that comes up the most in my office. It's people having a difficult time being kind to themselves. I work with a lot of people who have had a lot of success by being extraordinarily disciplined. And it sometimes is very difficult for people who've done well by being able to push back their body's needs, to learn to listen to the body, and to learn to respect it. The body is more powerful than you are, wherever the you part of us lives. Most of us think it's from the neck up, somewhere in here is the you part or the me part, right? But a nice metaphor is the elephant and the rider. So the elephant is like the body, and the rider is like you as the person who wants to control the elephant. The elephant is the part of the brain that's had millions of years of refinement. And the part of us that wants to control it tends to be, the newer part of the brain in terms of brain science, right? So if you're this little rider, you can't push the elephant body around. It's just not going to tolerate it. I mean, it's big and powerful. And so it's important for the rider to realize that the elephant is friendly and amenable to working together, but the most important thing is to be kind to the elephant.
Oh, I love that analogy.
Mm-hmm.
And I couldn't agree more. I think that that's something that a lot of people with IBD struggle with is, being kind to themselves. And
Mm-hmm.
so, okay.
Yes.
So I would love to get to your questions. So we have the first question. How do you confront a therapist about wanting to get a letter of accommodation for school? What do we need to share with them?
Well, I would want to know if you knew this therapist, right? Like a therapist that you've been working with, there shouldn't be any confronting involved. It should be an easy matter of just saying, I'd like this letter. Can you write it? And the question is, what do you need to share with them? Well, you need to share why you need it. If they don't know you well enough to know already why you need it. Yeah, so I mean, if there's some way in which I'm not quite getting to a part of that question, or Brittany, do you have a sense of something I might be missing?
I think my guess, and I could be wrong, but I think it's just a matter of maybe this person hasn't gone to a therapist yet, and they just don't know how to approach a therapist to begin with, and how to, mention that that's something that they're looking to get for school.
Yeah. Okay. So there might be a situation where you just want to see a therapist one time for what's called a psychiatric evaluation, and with the intention of getting a letter, allowing some accommodation. So there's no guarantee the therapist is going to conclude that you need a letter, but chances are, if you need a letter, you'll get a letter. It's Americans with Disabilities Act is very supportive of people having access if they have medical conditions. So, a psych evaluation is going to be different than therapy. They'll ask you a lot of questions about your medical and your medical history, your family background, that sort of thing. And you might not even need to see a psychotherapist for a letter of accommodation. A medical doctor could probably just as easily say this person needs a letter. This person needs accommodation.
Okay, great. That's good to know. So guys, if you have any questions, definitely add them to the chat box. In the meantime, I'd love to hear your thoughts on how does someone deal with the sense of lack of control, and can you speak to that a little bit?
So there's a certain amount of control that we do have. We can do very sophisticated things. Many of us can drive a car. And it's, when we think about the range of things we can control, we can hold jobs, we can have children and families and do all sorts of things that are very complicated with many moving parts. And then we're just kind of dumbfounded that we have these bodies that have a mind of their own. And it's very humbling. It just is. It's like everyone's going to be humbled by it. It's like anyone who's had hiccups, especially when we didn't want to have hiccups. We forget about those times. Like, I can't remember the last time I had hiccups, but I bet I've had hiccups 1,000 times in my life. Right? So these things, these moments of loss of control, they just come and go. And, it really is, it just kind of goes along with having an elephant body, right? Having a body that has needs and has things we can't control. We don't control, we can have some influence over heart rate and breathing. But basically the brainstem just takes care of those things. The brainstem controls our temperature, right? And so there's certain things that just keep this body machine running. But it's not a perfect system. And so, I think this kind of goes back to like, what do you have power to control and what don't you have power to control? So, and also our thoughts about a situation tend to make a annoying to bad situation a terrible situation.
Very true.
Right?
Very true.
Yeah. So where we do have control is how we think about something. So, if someone's having a really bad experience with sensation, you might not be able to stop that sensation, but you can certainly not tell yourself terrible stories about what it means. You can certainly say, we've been through this before, we've gotten through it before. It's a bump in the road. It's not the rest of our life.
Love that. Thank you. So we have a few other questions. So how do you balance feeling like you're doing everything you can to keep your symptoms at bay while also not being or becoming obsessive?
Yeah. So this is like where gentle control, and I mean control in quotes, right? Like, but we just can do the best we can. And obsessive control, that kind of goes back to having a sense of self-compassion. And it's okay to distract yourself. It's okay to play a video game. It's okay to do something frivolous or silly or just for fun. And it's just so going back to being kind. If you have a tendency to get very controlling and rigid, take 3 breaths. That's an intervention I recommend a lot. Just take 3 breaths. I don't care if they're the worst breaths you've ever taken in your entire life. Just take 3. And that can be a game changer in the moment for people.
Yeah, that's great. So, yeah, I think that's great because it all comes back to giving yourself a little more grace and knowing, okay, so you had some ice cream today and it's a trigger, but it's okay. Normal people have ice cream sometimes and you can too, and it's okay.
That's right. Yes. Yes.
So, okay, so we have another question here. So I was told that type A people tend to be more prone to having IBD. How do you not blame yourself?
Well, again, this gets back to what we talked about at the beginning of our time together today. Blaming yourself just sometimes leads to the shame spiral, okay, where you have a hard time being kind to yourself. And self-compassion and kindness is probably the best medicine that I know. And that doesn't mean you won't have any negative thoughts, because you will. You're going to have blamey thoughts, self-blamey thoughts. It's a song on the playlist. It's going to play, okay? But how you react to it, you just go, oh, it's that song. Oh, yeah, I'm saying those mean things to. So there's this concept called the second arrow. So the first arrow is like the negative thought you have about yourself, and then the second arrow is the negative thought you have about the negative thought you had about yourself, right? Like, I shouldn't do that. Oh my God, I'm doing that bad thing where I'm criticizing myself again. That's the second arrow, when you criticize yourself for having a critical thought about yourself. Okay, so we just want to have the first arrow, like, oh, I just said I was messing up again. And then you say, yeah, I do that. Yeah, everybody tries to control themselves by having that kind of self-talk. And, I'm not going to fall into that pit. I'm going to say everyone messes up. And, I'm just going to keep moving on.
That's great. Thank you so much for sharing that. I think a lot of people in this webinar will definitely benefit from hearing that. So. So, all right, so we have another, this might be the last question. Maybe we can fit in one more, we'll see. I've been working with a therapist for a long time. I always seem to minimize symptoms in therapy. What suggestions do you have for not minimizing them?
Well, since I can't ask you why you're minimizing, I'm not sure how to respond. Let me think about this for a second. So I think it's important to share with your therapist, hey, I notice I minimize, because then there's two of you looking at the issue. And so that's such clinically relevant information and such a generous piece of data to share with your therapist so that they can help you monitor and say, hey, you're telling me you're doing okay, but, we talked about how you minimize. So I'm wondering if you're minimizing. Like, maybe you are having a good day, but I need to check this out because you clued me in to how sometimes you try to act a little more cheerful than you really are. And all of you is welcome here.
Yeah, that's great. Okay. Do we have any other questions? I think we have, just see if there's anything else. Or is there anything else that you want to share with us?
Also, if I answered your question, but I didn't do it sufficiently, we can do a round two if you have more information to offer.
Oh, this is a good question. Are you currently taking new clients now? Are you accepting
I am.
clients?
Yes.
Oh, and then also, I'm not sure if I think it's a good thing to point out that Dr. Travis works with people for brief psychotherapy, correct? So can you tell us a little bit about that?
Sure. So I tend to work with people for a year or less. I tend to work on getting them to have skills that they can implement themselves. And that usually happens in the first couple months of working together. We fine tune the little tool bag. And then sometimes people come back for tune-ups, booster sessions, or something changes in their life and they want more support. They'll come back and we'll have a round two, maybe a year later. There are some people I see for longer than a year, but most people, if they do their homework and they're pretty dedicated to looking at how their thoughts are contributing. And also, I think it's important to mention that I don't ever say people's pain is in their head. I believe people have real legitimate pain and discomfort. Notice I'm saying the P word again. People have a bad time, right? And I believe that's real. But I also know, and science research supports this, how we think about the bad experiences can go a long way to make them less intense and shorter duration.
Definitely.
Mm-hmm.
Okay. Yeah. So someone is asking for contact information since would your website, okay. So I'm just going to share Dr. Travis's website in the chat box. Definitely make sure to click it, make sure to and like copy it and paste it into a new tab. So just in case when we close out the webinar that you don't lose it, and then if you want to contact her, you'll have it there already. So definitely do that. Yeah, well, I guess, yeah, let's wrap up. I think those were pretty much all those questions. And I think I can speak for everyone. I'm going to, who attended tonight to say that thank you so much for, taking the time to answer all of our questions. And I loved all the analogies that you gave. I love analogies. So I'm a big analogy person. So I know it helps me remember them, even what you said even more. So, I think you made a big difference tonight. And I hope that people, are able to, make a change based on this and hearing you speak. So I thank you so much I truly do. Thank you so much.
You're so welcome. Thanks for inviting me, Brittany.
Oh yeah, of course.
Yeah.
Of course. Okay, guys. So yeah, so definitely click on that link. Make sure you copy and paste it to another tab before it might disappear. I don't know. But again, thank you so much, Dr. Travis. And hopefully you guys can see why I wanted to share her knowledge and insights with you guys. And that's it for tonight. I will see you guys soon. Hopefully, everyone have a good evening, and I'll talk to you soon.
Okay. Bye, everybody.
Bye.